Hello, everyone. Thank you for your welcome, and a special thanks to Maurice Ohayon, who organized this great symposium. My name is Laurent Boyer. I'm professor of public health at Aix-Marseille University and assistant Publique-Hôpitaux Marseille. I am director of a research unit on public health and health services research in psychiatry, the CERES. I'm also a member of the Fundamental Foundation, which is dedicated to psychiatric disorder, and leader of a research network on mental healthcare trajectories and performance. Welcome to this presentation titled Depression in Healthcare Workers. Sorry. Next slide. This is my disclosure information. I'm fortunate to work with a number of national organizations in France that support research, as well as with some international pharmaceutical companies engaged in the research on real-world data and experience. Let's start by examining why it's crucial to prioritize the health and well-being of our healthcare workers. Embarking on a career as a healthcare worker is a noble pursuit, one that is deeply meaningful and intimately connected with individuals and families. These dedicated professionals are the heartbeat of our healthcare system, playing a central role in providing essential services to the population and improving health outcomes. Their role is fundamental in achieving a healthcare system that ensures better access, improved quality, greater efficiency, and a special emphasis on supporting society's most vulnerable populations to reduce health disparities. This focus on the health and well-being is not just a personal imperative, but also a societal one. However, healthcare workers faces numerous challenges in their demanding roles. They're often confronted with routine patient care demands, organizational pressures, and sadly, instances of workplace aggression. Additionally, their work environment can contribute to challenges in maintaining a healthy lifestyle, with problems of sedentary behavior, irregular eating habits, limited physical activity, problem of sleep, and all these problems are very common. Moreover, the COVID-19 pandemic intensified these health challenges by introducing direct health risk. Healthcare workers face an increased risk of burnout, which in turn raise the risk of depression, suicide, and other health issues, all of which can have repercussions on healthcare service quality. So, what do we know about depression in healthcare workers? We do know that the prevalence of depression is high among physicians, especially during the first wave of COVID-19. A lot of studies were performed. However, when it comes to other healthcare workers and the post-COVID period, our knowledge is quite limited. While we are aware that professional factors, individual characteristics, and health risk behavior are associated with an increased risk of depression in healthcare workers, we don't yet fully understand the interdependent relationships between these three kinds of factors. This understanding is crucial because it will guide us in preventing depression and tailoring effective interventions to support mental health of healthcare workers. So now let's talk about our objective. The primary goal was to measure the prevalence of depression in healthcare workers during the post-COVID-19 era. In addition, we aim to investigate the relationships between the different kinds of variables, individual, professional, and health risk behavior with depression. To do this, we employed a statistical approach known as structural equation modeling. This method allowed us to examine a complex theory that involves intricate relationships between professional, individual, and health risk behavior with depression. It's a powerful tool for uncovering hidden connections in our data. Now let's demystify structural equation modeling for those who might be not familiar with it. So SEM isn't just a single statistical technique, it's more like a powerful toolkit. Imagine SEM as a toolbox containing several tools like psychometrics, factor analysis, and latent variables. It's all about modeling relationships between observable and hidden variables, also called latent variables, exploring both direct and indirect connections with our data. In statistics, a latent variable refers to a variable that cannot be directly observed or measured. Instead, it is inferred or estimated from other observed variables or indicators. Latent variables are used to represent underlying concepts or constructs that are not directly measurable, but are believed to influence the observed variables within a statistical model. SEM will help us to understand complex phenomena by connecting these different latent variable and observed variable in a big model. So now let's delve into how we conducted this study. So this is an online cross-sectional approach targeting healthcare workers in France during May and June 2021. To gather participants, we used social networks, professional associations, and email invitations for recruitment. Our primary criteria was depression based on the CESD with a definition of depression, a score higher than 17 for men and 23 for women. On this slide, you can see the three big latent variables, individual characteristics, health risk behaviors, and professional factors. The three categories will serve as a basis for structural equation modeling. We will investigate how these three latent variables directly relate to depression and explore their interconnection. So first and main finding is the high prevalence of depression within our participant population, regardless of depression, regardless of profession. Our nationwide survey involving more than 10,000 healthcare workers estimated a depression prevalence of 13%. On this slide, don't be afraid. This is a figure of the SEM. And you can see here, represented by three big circles in the middle of the figure, you can see the three latent variables: individual, health risk factors, and professional factors. Surrounding this circle are all the observed variables that make up these latent factors. You can also observe our outcome variable, depression, which is an observed variable represented by a square. The arrows you see indicate statistically significant relationships between them. We will describe this connection on the next slide more simply. The factors we considered in our model all had a direct impact on the risk of depression, with professional factors having the strongest influence. This is a very interesting result because we can act on it. Moreover, both professional individual factors indirectly affected depression risk through their influence on one another. In statistical terms, the beta values represent the strengths and direction of the relationship. A beta value of 0.3 is considered as the moderate effect size, indicating a meaningful impact. Standardized beta values provide a way to compare the relative importance of the different factors within the model, allowing us to see which factors have the more substantial influence on depression risk compared to others. So, to summarize the key takeaways from this study, first, we found a high prevalence of depression, very high, with weights ranging from 29 to 32 across different categories of healthcare workers. Our SEM revealed that depression had moderate associations with various factors, including professional, individual, and health risk behavior. And among these factors, professional had the most substantial effect on depression risk. We also identified indirect relationships between professional and individual factors and depression mediated through their influence on risk factors. Among the professional factors, burnout, sustained workplace bullying, and low decision-making attitude were strongly associated with depression. So this study sheds light on the prevalence and contributing factors to depression among healthcare workers, highlighting the importance of addressing both individual and professional factors to improve the mental health and well-being of healthcare workers. So in conclusion, despite the initial focus on depression in healthcare workers during the first wave of COVID-19, our data indicates that the high rates of depression continue to be persistent and concerning issue. This call for urgent attention and should be considered a top priority in public health. This finding should serve as a wake-up call for healthcare policymakers, emphasizing the pressing need to address the overall health and well-being of healthcare workers. It is imperative that steps are taken to provide support, resources, and interventions to mitigate the impact of depression on this critical workforce. To finish, I would like to thank my team and many colleagues without whom all this work would not have been possible. I also want to thank again Maurice Ohayon for his invitation. And so let me thank you very much for your attention. And of course, if you have questions, I will be happy to answer for the next step of the symposium. Thank you very much.